Hi there, and welcome to Lesson 4.2, an in-depth guide to building professional health relationships. As we continue to close the communication gaps between ourselves and health professionals, we will realize that a key player in opening the line of communication is how we manage and record our healthcare once we leave the physician's office. So in this lesson, we will go along with Joe and take a look at how he manages his working medical relationships. Then, we will see how Patient Better has helped Janie improve her professional care just by knowing what she should do as a patient once she leaves the medical practice. This video may go a little fast, so if you haven't done so already, have the presentation notes in front of you. And be sure to watch the video all the way through for the first time, and then go back to the parts that you need more clarity on. So that way, after this lesson, you will be able to follow the doctor's recommendations better and be able to reap the benefits of participating in an information-driven appointment that will allow you to achieve the optimal health outcomes. And your key lesson takeaways are to understand the difference between people who have learned how to manage care and the ones who have not, and why it is important. Know the 4-6-step medical office visit and what you can do to make the most out of your appointment, as well as be a more knowledgeable participant in the medical office visit that will ensure that you get the highest quality of care. Now, in order for us to achieve our knowledge goals, we will first compare Joe and Janie's participation in healthcare. Then, we will walk through the 4-6-step medical office process, and then afterward, we will further examine the 6th step. Let's take a look at Joe and Janie's relationship with their providers and compare the two. Afterward, you should have a clear understanding of how the medical office visit processes works and how knowing this information helps you, patient better. Research shows that patients who apply self-managing knowledge are perceived to be more successful in care. And the most essential key to being a successful patient is to follow the doctor's recommendations. Doctor recommendations are the advice or instructions from a licensed professional offering a prioritized list of selected directions, recommendations, or orders to achieve optimal health outcomes. We will better equip ourselves to successfully follow directions by understanding the 4-6-step medical office visit process, which is discussed later in the video. Let's take Joe for example. He waits until the last minute to make an appointment, even though he hadn't been feeling well the last 2 or 3 days. Joe doesn't have an assigned primary physician, so he just makes the first appointment with the doctor on demand. Joe plans to tell the physician, "Oh, how sick I am," and in hopes that he's going to get some antibiotics by the end of his visit. Here's the problem though. Joe is just as unprepared as he was his last medical appointment. Although Joe was able to describe how he was feeling today, he did not prepare any chief complaints, helping the nurse to effectively diagnose. And Joe did not take his vitals, nor did the nurse have any access to Joe's medical history. And with this limited information, the nurse wasn't able to properly diagnose. And unfortunately, his insurer deemed this encounter incomplete and denied coverage. And because the doctor-on-demand nurse did not have any medical history or the vitals, she could not deem antibiotics as a medical necessity, so she directed Joe to go over the counter. After a couple of days, Joe realized that his over-the-counter medication didn't work, thus leaving him having to go to an urgent care center where he can fill out the forms for a proper health history and the doctors can check his vitals adequately. Nevertheless, the medication started working after only a couple of days, so Joe quit taking it. And if history repeats itself, he won't think about the doctor's office until he's sick again. Even though that appointment may have turned out smoothly, if Joe documented this occurrence, he would have safeguarded himself from further relapses and from any insurance claim issues. With all the changes in healthcare, it's more difficult to maintain a relationship with the doctor, and the idea that your physician will take care of everything, those days are gone. That's why it's more important than ever to make sure that your medical record is up to date, ensuring that you have a quality medical visit, even on your worst days. Just like Janie. Now let's check out the 4-6-step medical office visit process Now, this concept applies to both in-person and virtual medical office visits. Let's go through the 4-step process of appointments for professionals. First, they'll have the patient check in. They'll have them produce identification, insurance, and possibly fill out or update any forms if necessary. Secondly, they'll have the patient go into the treatment room for a pre-assessment, where the assistant will check blood pressure, heart rate, and weight. This is also known as checking vitals. They will also prepare a preliminary assessment for the clinician. The third step to this process is time with the provider. The doctor will further investigate by asking direct and routine questions regarding the well-being, any new medication, or life changes. The last step is to check out, and that's for patients to make any payments, co-pays, and set up any follow-up appointments if necessary. Whereas Janie recognizes, just like Joe, there are 4 medical office visit steps that she will need to go through. But with her newly adopted self-managing skills, she understands that there are 6 steps to the actual appointment, and it goes like this. First, it's preparation. She schedules the visit, she does her templates, and she updates her organizer. Secondly, when she checks in, she already has her identification and insurance card ready. She's also prepared to update any forms. Thirdly, once she reaches the treatment room, she brings in her medication and chronic condition template, and she is ready to answer all 3 routine questions about any changes in her health or medication. Janie also understands there is a very short amount of time with her provider, so that's why she had already set up her soap note, and she already has her chief complaints ready. And when Janie checks out, she is not surprised by any payments. She's ready to schedule any follow-up appointments and connect with ancillary care with a referral coordinator if needed. Now let's take a look at how the 6th step is the most important step in the 4 6-step medical office visit, and see how Janie is able to utilize patient better to its maximum capacity during this 6th step. Because now, Janie is able to follow the physician's recommendations better by completing and documenting medication as prescribed, fulfilling any diagnostic requirements, and applying individual doctor recommendations such as diet, equipment use, or therapy, keeping all follow-up appointments regardless of your health status, as well as self-managing and recording health in between office visits. And that concludes our lesson for today on learning what we can do to become a better participant in appointments that will get us the best care possible. Join me in our next lesson, 4.3, to see how your medical appointment actually starts right when you enter the office.